From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it is time to visit with Dr. Josiah Fitzsimmons from Vero Neuropathy to let you know what he can do about your neuropathy pain. Hello, Dr. J. How are you?
Hey, I'm doing great, Lou. Thanks.
Great. Now, we first and foremost want to talk about what is going on in the body when people experience peripheral neuropathy, because it can be debilitating. It really can.
Absolutely. There's so many people that come into our office on a daily basis with neuropathy, and it's been affecting their life for so many years, and they've been told there's nothing that can be done about it. You have to just live with the pain, take these medications, and just live with it. But that's just not the truth. But neuropathy is a condition of nerve damage where the nerves slowly get degenerated over time, typically exposure to chemotherapy, toxins, diabetes for long periods of time, statin drugs, all different things that can cause inflammation, actually deteriorate that outer coating of the nerve.
Now, you mentioned over time, so it doesn't come on all of a sudden. It just slowly sneaks up on you.
Exactly. For most people, it might start off as numbness and tingling in their feet or their hands or different parts of their body. They might think, hey, it's no big deal.
And this is numbness and tingling that could happen for a while, then go away, and then come back. Is that right?
Exactly. Think of it like your electrical cable for your phone plugged in. If you have, if it's frayed, maybe it charges good, maybe it doesn't charge good.
Right.
And you're kind of like, it's not working very well. You're trying to just put up with it. That's what people are doing with their body.
Exactly, yeah.
Exact same thing.
But then you mentioned the medication some people take, which is not really a good idea because it's not fixing anything, it's just masking it. But now, is this a disease in itself?
Great question, great question. So yeah, gabapentin, Lyrica, Cymbalta, many of the common medications you're just mentioning just mask the symptom. But neuropathy is not classified as disease, classified as a condition of nerve damage. Typically it's caused, by other diseases or other things that you have in your body. Like I said, exposure to toxins, Agent Orange, maybe chemotherapy, very, very common. We actually get lots of referrals from medical providers that know their patients, hey, you're most likely going to get neuropathy. Before they even start chemotherapy, they start sending them to us to actually proactively treat the neuropathy that they know they're most likely going to get. Also, like I said, diabetes is a really big one. People that have prolonged levels of sustained high blood sugar levels really can cause neuropathy. Also, lots of farmers with exposure to pesticides over the years. Huge majority of our patient base are farmers that have been exposed to different toxins over the course of their farming career.
I'd never heard that before. That's amazing that would really play effect on that. Now, we're talking about having a disease here, and this is a condition of the disease. That's really important to keep in mind.
Absolutely, because I want people to understand that this is a treatable condition. People have been told for decades and decades, there's nothing you can do about your neuropathy. You just have to live with it. You just need to take these medications, maybe feel a little bit better, mask the symptoms, but then you get all the side effects of the drugs on top of it. That's absolutely not the case. I mean, one of the farmers I was just referencing that came into our office hadn't felt his feet in over 20 years.
Wow.
Literally stepped on a nail 2 inches thick through the bottom of his foot. 6 weeks within starting our program, he felt his feet for the first time in 20 years, broke down and cried in the shower, changed his whole life, and he just thought he had given up at that point. And so many people just don't have to give up. They can have a much better quality of life. They just need to do something about it, get into our office.
This is a condition that can be treated, and Vero Neuropathy can help.
Absolutely.
Okay, now what can be done here? What do we need to do here to take the first step to getting some treatment?
Great question. Biggest thing is come into our office. What we do in our office is we actually do 8 different individual tests to calculate down to the exact percentage of sensory loss that someone has with neuropathy. That'll help us know exactly where it's at, how long it's been going on, what stage of degeneration of the nerve has occurred. So once you get up over 80% nerve damage, typically you can't get full reversal of the condition. So we want to try and catch it as soon as possible. But we've had people, like I said, that have gotten over that level that have still gotten amazing results. But the further and farther it goes along, the harder it is. As I said earlier, it's a progressive degenerative condition. It's only going to keep getting worse if you don't do anything about it. Some people think, oh, it's getting better, I don't feel it anymore. Well, they've actually totally lost the sensation. They think it's getting better, but they just can't even feel their feet or their hands anymore.
All right, you can get in right away, folks. They have plenty of doctors that are there waiting to treat your condition, and you have a special going on right now.
Absolutely. Biggest thing is, like I said, you need to get on top of this condition as soon as possible. Come into our office. We have an amazing special for our Iowa Live viewers, $200 off the initial consultation, exam, report of findings. Like I said, we're going to do 8 different unique tests on that initial exam to calculate down to the exact percentage of sensory loss, come with a personalized game plan.
There you go. 335-VERO is the number to call. 335-VERO-515 area code. Take advantage of the $49 neuropathy special. Save $200, like you mentioned. Great job and great information. Hopefully we can get people treated.
Absolutely. Thank you for having me.